Hello, my name is Nurse Brown, and I will be doing respiratory, cardiovascular, HEENT, musculoskeletal, and neurological assessments today. Can you start by stating your name and date of birth for me?
Emmanuel Dawson, December 3rd.
Alrighty. And have you been having any chest pain or shortness of breath?
No.
Alrighty. I would like to start with checking your respiration rate, and we can start now. You can just relax. Alrighty, your respiration rate was 20 breaths per minute. And now I would like to listen to your lungs. We're going to start with the right upper lobe. Just breathe in for me and breathe out. And then the left upper lobe, breathe in and out. And then the left lower lobe, in and out. And then the right middle lobe, in and out. And then the right lower lobe, in and out. And then the left lower lobe, in and out. And now we'll check the posterior side, starting with the right upper lobe. You can sit up for me. Go in and out. Alrighty, the left lower lobe, the left upper lobe, in and out. And the left lower lobe, in and out. And the right lower lobe, in and out. Alrighty. Now there are techniques that you can use when helping the respiratory system. One being the sensitive spirometer. You can use it 10 times an hour while you're awake, or you can also use it during commercial breaks while you're watching TV. You just inhale through the tube, and basically you'll monitor your goals that you set for yourself and improve your lungs. Now the second one is a deep breath in, you turn and you cough. And what this does is it helps loosen up mucus inside your lungs, and it can also help prevent pneumonia. Alrighty. So you just basically do a deep breath in, turn, and then you cough. Alrighty. And now I would like to check, we'll do the cardiovascular assessment. I would like for you to tilt your head back, and then we'll check for JVD, jugular venous distension on both sides. And then I will also check the radial pulse. I'll also check the radial pulse to make sure he has a good pulse. And I'll also check the dorsalis pedis pulse on both sides. And I'll also check the posterior tibial pulse on both sides. Alrighty, and I'll also check for any edema in both of the upper extremities. And also I'll check for capillary refill in the fingers for good blood flow. And I'll also check in the lower extremity for capillary refill and edema. Now I would like to listen to the heart. What you like to do is go to the collarbone on the right side, go down to the second intercostal, and place your stethoscope diaphragm over it. And what you'll do is listen to the aortic area. And then you'll move over to the right side, to the left side, and you'll listen to the pulmonic area. And then you'll go down to the third intercostal and listen to the Erb's point. And then you'll go down to the fourth intercostal, listening to the tricuspid valve. And you'll go over, lining up with the mid-clavicle point, mid-clavicle line, to the fifth intercostal, and you will be listening to the apical pulse. All right. Now, have you been having any type of headaches that I may need to be aware of?
No.
Okay, then I'll check for facial symmetry, and then I'll also ask, what about hearing? Do you have any hearing problems or hearing impairment? You don't, okay. I would like to ask you to scoot up for me just a little bit. Alrighty, what I'm gonna do is, I'm gonna do something and just tell me if you hear it. Okay, you hear it? I'm gonna check the other side and ask him, do you hear something? Do you hear it?
Yeah.
Alrighty. And now, after I do the ear check, I will also ask, are you having any blurred vision?
No.
Okay, and you do wear glasses, correct? Okay, I'm gonna ask, could you remove your glasses? And I'm gonna ask you to stare at a far object, and then I want you to stare at this highlighter. Alrighty, so just stare at the far object. Alrighty, and then now you can stare at the highlighter. Alrighty. Now, do you have any type of stuffiness or red nose that I might need to be aware of? Okay. What I want you to do is called the nostril patency, and what you do is place your index finger on one side of your nose, and you'll inhale in, and I'll just look on the inside. Alrighty. And then you'll do it to the other side, and I'll look in. Alrighty. And what about, have you had any type of sore throat or dry mouth that I may need to be aware of, or oral complications? Okay. And what I'll do is just ask him to open his mouth and say, ah, and look. Alrighty. And then next, I will ask you to swallow this. Just take a sip of it. You don't have to actually take a sip of it, but just, yeah. Alright. And that's checking to see his capability of swallowing. And now I will do the neurological assessment on you. Do you know where you're at right now?
Yeah.
Okay. Can you tell me where you're at?
The Middle Georgia Library.
Okay. And also, what year it is?
2022.
Okay. And also, do you know why you're here?
Yeah, for your video.
Okay. All right. And now, after the neurological assessment, I will be doing a musculoskeletal. I will start with grabbing the joint, which is the neck, and I will ask you to tilt your head up, which is the hyperextension. Then you'll tilt your head down, which is the flexion, and then you'll touch your ear, which is shoulder, which is the lateral flexion, and then you'll do it on the other side, lateral flexion, and then you'll rotate your head to the right, which is rotation, and you'll rotate it to the left, which is rotation, lateral rotation. Okay, now, and I will be doing the same with the wrist. I grab the wrist joint. You'll tilt your hand up, and this is hyperextension, and then you'll lay it flat, which is extension, and you'll go down, which is flexion. And also, what you'll do is put it back up again. Then you'll move in towards you, which is adduction, and then you'll move away from you, which is abduction. All right, and then you'll do it in the other hand. You just move up, to the right, to the left, alrighty, and down, alrighty. And now I will be doing the same for the lower extremity. What you'll do is, I'll ask you to kick your leg out. You can just kick your leg out for me. You'll try to kick it out, just kick it out. Alrighty, and I'll check the other one, see if you can kick it out. You'll just kick it out for me. Alrighty. And then the normal standing is extension. And now what I'll ask you to do is stand up for me. Okay, now can you stand on your, pick your right leg up. Okay, this is bending, which is flexion. And now you'll pick your left leg up. Alrighty. And now standing for hip, could you bend your knees again? Bend this knee up and then this one again. I just have to feel for it. And then I'll feel for the other one. Alrighty. And now what you'll do is, for hip, you'll just pick up this knee. Alrighty. Pick up the knee again. And then pick up the other one. Alrighty. And could you kick back for me? Just try to kick back like a donkey kick. Alrighty. And you'll kick back on the other side. Alrighty. And one more thing, could you just pick your leg up like this? Alrighty, and do it again on the other side. Alrighty, and then another assessment I would like to do is the gait walk. Could you just do a normal walk from this side of the wall to the next? Just a normal walk. And walk back. And now could you do a heel to toe for me, just in a straight line, a heel to toe, and try to walk in a straight line to the best of your ability. All right. And the next thing I would like to do is ask you to stand here and just close your eyes for me and just try to stand still to the best of your ability. All righty, you may sit down for me. Okay, so have you had any falls within the past 3 months?
Oh, no.
No, you haven't. Okay, and what about diagnosis? Are you diagnosed with anything? Okay. And what about, do you have impairment when you walk, or like you can't move at all, or you're weak? You're not weak. Okay, and what about, do you need assistance like a crutch or cane or anything to move around? You don't. All right. All right, now another thing I would like to go over with you is a type of scale, which is the Glasgow Coma scale, and it's basically used reliable to help measure the level of consciousness in people who done had recent brain injury. And another thing I would like to go over with you is safety precautions, safety measures to help our patients out. One is making sure you always have on grip socks. Another one is making sure you have your call light with you 24/7 or a phone with you in case of emergency. Also making sure that the light is visible for your seeing, and also making sure your bed is lowered to your capability of moving in and out. And also making sure that us as nurses are on our hourly roundings to make sure that our patient is well taken care of. And I thank you.